Good morning, ma'am. So I am Jessa Domingo, your nurse for today. So for today, we are going to assess your ears, eyes, nose, and throat. So let me just take my hand hygiene and put the gloves for what? So, well, I'm on this. May I know your name, ma'am? Your age. Okay. Before we start, I would like to ask you if you have a history about hypertension, diabetes, hypertension and diabetes. Okay. Do you wear glasses or contact lenses? Okay, thank you. So we are going to first inspect the patient's eyebrows. So the patient eyebrows are even. The alignment is straight and the texture is smooth. Okay, ma'am. So can you move your eyebrows for me? So the movement is at once. Okay. Let's proceed to her eyelashes. The eyelashes hair is frequent and the direction is straight. For the eyelids is symmetrical. It covers the sclera and the cornea. The cornea perfectly. Can you blink for me, ma'am, tightly? Okay, the blinking is at once. For the pul pulpiral, pulpiral and bulbral conjunctiva are normal. Now I am going to touch your eyelids and I'll apply cotton. Okay, the patient has no foreign bodies and swelling process. Now I am going to check the conjunctiva. Okay, so the conjunctiva are pink, which is normal because of the blood supply. Now I am going to touch your lacrimal glandulate. Okay, here. Okay, do you feel any pain of this? So your lacrimal gland and your lacrimal gland, there's no swelling, tenderness, and no masses found in her lacrimal and lacrimal duct. Okay. So now we are going to shine. We're now going to shine the light of your eye. Okay, ma'am. Okay. Again. So the pupil are normal. They can react with the presence of the light. The pupil's color is black and they are symmetrical to each other. And the size of it is 3 to 5 millimeter in diameter, which is normal. Okay. Now we are going to check for accommodation. So I want you to watch this object and the wall at my back, which will serve as your far object. And now alternate the gaze. The near, far, near, far. Okay. The pupil are constricting when it is focused on the near object and dilating when it is focused on the far object. Now we are going to light again. Okay. So the response is still normal because they are constricting when it is exposed to the light. Now we are going to check for visual film. I want you to cover your eye, your left eye, and tell me if you saw my hand. Okay, the other one. Okay, so the response. So the patient peripheral vision is normal. Now, next, we are going to check for the ocular muscle test. I am going to direct this into 6 point, and I want you to look this with your eye only. So now I want you to, okay, the patient eye are normal. There is no stagnus present. And now I want you to read the letters on the wall, on the wall, with with your with your one eye covered, and read the letters as far as you can. Okay, the other one. Okay, both. Okay. So the patient visual is 20 over 50, over 40. So for the patient ear, now do you have any problem with your hearing lately? Now I am going to inspect first the patient external ear. Okay. So the ear color is with same with her skin, and the position is symmetrical with each other. Now I am going to palpate. Now I'm going to palpate for the patient ear. Here. Do you feel any tenderness? So I do this. Okay, so the patient ear is elasticity is normal, and there's no tenderness found. Now I am going to check for the seronomen. Okay, and here. Other side. Okay. The patient ear has a seronomen which is normal, and there's no blood and lesion found inside. Okay, so next I will check your vestibular cochlear nerve. Now we're going to test your hearing. To start, I am going to palpate one hand in your ear, and I am going to whisper any number or words, and I'd like you to repeat it, okay? Okay, now that you are okay, next. Now we are going to perform the Weaver test. I am going to put this tuning fork here and tell me if you hear the vibration. Okay, I want you to occlude your right ear and tell me if you hear any vibration. Okay, the other one. Now, for the Ramberg test, I want you to stand for me and put your hand at your side and close your eyes. Okay, now, thank you. Now you can sit down. Okay, for the Ramberg test, it is normal. Next, let's move on to her nose. Okay, ma'am, may I ask you if you have any allergies? Do you have any hard time breathing? Now I am going to inspect her external nose. So the nose is in the middle of the face, and the color is the same with her skin, and the shape of it is symmetrical, and there is no discharge. Now I am going to palpate your nose. Okay, do you feel any pain? Okay, the nose texture is small. There's no discharge and discoloration of bone and cartilage found. Now I am going to check for your nasal cavities. Okay, so the nasal cavities is normal. There are no blood and lesion found. Now I want you to occlude your one nose and breathe for me. Okay, next. The other one. Okay. Now I am going to test for your maxillary. Okay, here. Do you feel any pain? Okay, the patient nose is sinus and the patient nose and sinus are normal. Okay, let's move to the mouth and throat. Now we are going to inspect first the patient lips. The patient lips is pink and symmetric and it is in the middle of the face. Now I am going to touch the lips. Okay, the lips is moisturized and there's no lesion found. Now I want you to open your mouth wider. Okay, so the intenses duct and buccal mucosa are pink. It is normal, and the gums is pink also, and the teeth is yellowish, which is perfectly normal. And the number of her teeth is 31. Now, for the inspection of the tongue, I want you to open your mouth. Okay, the tongue color is color pink. The texture is smooth and there's no lesion found. Okay, I want you to open it again and put your tongue to the top. Okay, the base of the tongue is pink and there is no lesion found. Okay, I want you to move your tongue for me, side. Okay, sideward. The mobility of the tongue is normal. So for the base of the tongue, I am going to use a gauze pad. Now I am going to hold the tongue and up it. Okay. There's no lesion and wounds found in her tongue, and also there's no lumps. Now open it again. Stick your tongue. So the palate and the soft palate is normal. There's no lesion and edema found. For the uvula, I want you to say ah for me. Ah. So the uvula mobility is normal. Now I'm going to check the patient tonsil. Okay, I want you to open your mouth again and stick your tongue. Say ah. Okay, so the patient tonsil is at the degree 2, and now we are going to use the tongue decompressor to check her gall reflex. So say ah. Okay, the gall reflex is normal, so there's no problem with the patient eyes, ears, and nose, and the throat.